Okay, so we're going to go ahead and get started here. While my group is away, I'm going to move my mask so it's a little bit easier for me to talk. Thank you for having us here. We are the Sac State nursing students. My name is Augustina. We'll also have Christopher, Heather, and Roxanne presenting today. And we wanted to ask you guys, what's in your medicine cabinet? We'll be talking about polypharmacy for the polyaged, and we'll get more into that. Okay. One sec. Do you guys know how I can? Okay, so at the end of this presentation, we want you guys to be able to define or have an understanding of what polypharmacy is and some of the causes of polypharmacy. We also want you guys to be able to identify and prevent some of the adverse effects that polypharmacy causes. Also, we want you guys to be able to understand and recognize high-risk medications and what we can do to prevent any mishaps that can happen with polypharmacy. Takes a minute for my slide to change. Oh, there we go. Okay, so before we get started, I wanted to talk about our age group and people that are most at risk for polypharmacy. So currently in California, we have about 6 million older adults or those over the age of 65. In 2060, that's going to increase, or it's predicted to increase up to about 23% of our population, which is about 95 million people. It's projected that 1 in 4 adults who will be 85 years old in 2060. And a lot of this increased life expectancy can be thanked from the advancement in medication management and all the management that goes into dealing with multiple comorbidities with those over the age of 65. Okay, so CDC actually qualifies and identifies goals of medications for health improvement, and those can be categorized into physical, psychological, social, and overall health promotion and disease prevention. So we can be taking a medication that can help with a physical heart problem, and we can also be taking a medication that can help us psychologically or socially. And there are those medications that also just help promote our well-being. It could be vitamins, it could be herbs, just different supportive medications. So CDC qualifies those as being your measures of healthy and quality of life, and those can go into play with how we deal with those medications and the way that they make us feel in those different categories. Okay, so what is polypharmacy? Polypharmacy can be defined as taking multiple medications, and a lot of times this is defined as taking 5 or more prescribed medications. A lot of times we see this in adults over the age of 65 because they are dealing with a lot more multiple comorbidities. And studies show that more than half of the adults over the age of 65 do take more than 4 prescription medications. This can be seen as a pill for every ill. So we're not feeling well, we take a pill for that. You know, we start having another issue, we take a pill for that. So we need to be very careful when we are taking these medications, and we need to have an understanding of why we are taking them and how they are helping us. So we took a look at some data. This is a little outdated. It's back from 2007, 2008, but we did see a correlation in older adults taking more medications. So we see here with those being over age 60, they are taking much more prescription medications, 5 or more, and we can see that trend occurring. Here's another image that we saw that trend happening again. We see that those 61 to 70 or even 70 to 80 years old, they're taking 4 or 5 prescribed medications for their illnesses. Next, Heather's gonna, oh, not yet, this is still me. So I did want to go into a little bit more about the good versus the bad polypharmacy, which does exist. So there are appropriate means for taking more medications. And a lot of times that can be seen with complex conditions. And in these situations, this is where the potential benefits of those medications that we're taking are, those outweigh the harmful effects that the medications can cause. So we need to be aware of that. There are problematic polypharmacy trends as well. And these can be seen when the harms of those medications outweigh the benefits. This can happen if you're taking medications that are expired, if you're taking multiple medications for the same problem and the effects are kind of being contraindicated or they're being canceled out. So it's important to be aware of that. Next, Heather's going to go into how this polypharmacy happens.
Hi, everyone. As Augustina mentioned, I will be going into problematic polypharmacy, and that's when the risks or harm from multiple medications outweighs the benefits. So how does this happen? It happens in two different ways, on the patient's end, but then it also on the doctor's. First, I'm going to start with how it happens with patients or older adults. Here we have a list, so it might be because you have multiple physicians or prescribers, and this makes it harder to keep track of your medications. It might be mixing over-the-counter medications you can get at a CVS with prescription medications. Sometimes those don't mix so well. It could be that you're discontinuing a prescription. Now, only do so if you have the approval of your primary care provider or whoever prescribed you the medication. Could be that you're taking an expired medication or that you're taking the wrong dosage. In either of those contexts, that could have a really negative or even a deadly effect on your body. Maybe the technique is incorrect. For instance, you're injecting the medication incorrectly, or it could be that you're taking the medicine on an empty stomach and you need to have it with food. Lastly, it could be that you're consuming inappropriate foods with medications. For example, you're supposed to avoid grapefruit and you don't do so. Now, here we have how do healthcare providers contribute to polypharmacy. It could be an error on their end. There's a prescription error when they write it out or when they send it electronically to the pharmacy. Or it could be that it is a potentially inappropriate prescription or medication. In either of those scenarios, this could lead to adverse drug effects, adverse drug reactions or side effects. Here we have a list of common adverse drug reactions of polypharmacy. Now, this is a compilation of different side effects from different drugs, just to give you an idea, and of the most common adverse drug reactions. So we have dizziness, which often the fear with that is that it can lead to falls and fractures, drowsiness, constipation, might cause bleeding, might cause urinary retention, problems with breathing, central nervous system depression, CNS depression as we call it, decreased rate of breathing or decreased heart rate, or loss of consciousness. Could hurt your kidneys, could cause you to have a high or a low potassium, which could actually lead to heart issues, could cause hypoglycemia or cardiovascular events. Now, the takeaway with this is that every medication has its specific side effect, but what the provider is counting on is that the benefits of the medication will outweigh the side effect of the side effects that you experience. So your responsibility here is to mention the side effects, to notice the side effects, and then share if they affect your quality of life. For instance, if something's causing you to feel dizzy, that could potentially lead to a fall. And if that's happening frequently, then you want to make sure that you let your healthcare provider know that. Here's a list of some common high-risk medications. On the left, we have the over-the-counter high-risk medications that you can buy at a drugstore. We have diphenhydramine, also known as Tylenol PM, Advil PM, or Benadryl. This can be used for allergy or hay fever or the common cold. We also have oxybutynin, and that is for overactive bladder. Typically, it's prescribed to women. We have our NSAIDs, and this is one of the most common ways to control pain: ibuprofen, Motrin, Advil. Then we have those medications that are used for heartburn, our PPIs, proton pump inhibitors, omeprazole and lansoprazole. Make sure to always keep your healthcare provider notified when you regularly take any of these medications, because they might interact with your prescribed medication. Now, on the right-hand side, these are not specifically medications that are high risk for only older adults. They're just kind of high risk in general. So just take note of those. We have our anti-infectives, our potassium, and any electrolyte you may take, insulin, narcotics, chemotherapeutic agents, or heparin and the other anticoagulants. Now we are going to have Chris come over, and he is going to tell you how to minimize problematic polypharmacy.
So what can we do about problematic polypharmacy? Well, there's a lot we can do, but you need to be the one to start it off. Some things that are important for you to do to make sure that problematic polypharmacy doesn't affect you is to understand medication functions and report any side effects that you might feel. Really, the healthcare provider cannot know what side effects you're feeling until you tell them. It is important, though, to not suddenly stop taking a medication until you talk to a provider. Finally, you should use one pharmacy and prescriber to make sure all of your medications are being reviewed and in order and are appropriately interacting with one another. Here's a really fun picture of some hands. The question is, patients and healthcare professionals, do you report side effects? And we ask this because, again, it's very important that you report side effects. So providers and other members of the healthcare staff can finally determine if the medication is effective for you, or if there are alternative medications that would function better in their place. Here's another diagram that kind of shows the relationship between doctor, nurse, and pharmacist. You see, they all form a circle that interacts with one another in order to provide care for you, who is in the center of the circle. In terms of a clinical team, it also includes the nurse, physician, and the pharmacist, but also it includes you, the client. And we need you to help us do a detailed medication review in order to understand what medications you are taking, how they might interact with each other, and any questions or concerns that we might have about how those medications have been affecting you. It is important for you to talk to a nurse or physician about any over-the-counter or herbal medications you might be taking, because those medications might also affect your prescribed ones. Some things like roots or traditional Chinese medicines may also have an effect on your own body and the other medications you might take. So in order to facilitate this, it's important to start a dialogue and communication between the patient and the clinical team. So dialogue between the patient and clinical team are very important. The medication regime plus the patient lifestyle ultimately leads to the most effective patient treatment. Moving on, disposal locations in your community are also important to identify so you can safely and responsibly get rid of any medications that you no longer take or no longer need, as approved by your provider. Next, we're going to move on to Roxanne, who's over here.
Okay, it's like a two-handed job. We're having a little technical thing here. Roxanne, oh yes, Roxanne's a little taller than the rest of us. So see that one over there? Here's the problem. There you go.
Okay. Thank you. Okay. Hi, everyone. I'm a little tall, so we had to change the setup here. So as Chris mentioned, medication disposal is an important component of polypharmacy. It is best to safely dispose of any unused and expired medications at local disposal sites. The U.S. Drug and Enforcement Administration organizes an annual prescription drug take-back day. And this is organized in communities across the states. You can visit the DE website to locate dates and locations regarding the annual prescription drug take-back days. We will put a link to the DEA website in the comment sections following our presentation today. Okay. Here on the, here on the next slide, we have listed local disposable or disposal sites where you can drop off your medications year-round. As you can see here, they're within a 10-mile radius of the Rolling Oaks facility. And here we have listed Kaiser Permanente Pharmacy. You do not have to be a Kaiser Permanente member to drop off your medications there. You just go into the pharmacy and drop any unused or expired medications in the drop box. So you definitely have that as a resource in your community. There's also Safeway on Pleasant Grove Boulevard that allows you to do the same thing. They just have disposable bins within the pharmacy or near the pharmacy that you can drop those medications off, where you can drop those medications off. Okay. And next, we like to close our presentation with reviewing just overall appropriate steps to polypharmacy. And we'd like to start by letting you know that you are what matters. Your health and well-being are essential to effective medication management. It's important to ensure that you are taking the right medication for the right reasons. Your healthcare provider and other healthcare professionals are excellent resources for making sure that you're taking the medication, it's being effective or is effective for your condition, and that you're alerted of any high-risk medications or harmful side effects. You can, again, safely dispose of any unused or expired medications at local disposal sites. And that concludes our presentation. We would like to thank you for watching, and you have a great day.